Well, kids are heading back to school and student athletes are gearing up for fall sports. Experts say it's important to evaluate their health and fitness before taking the field. It's also an opportunity to address any medical needs to help prevent injuries. This morning, Dr. Ryan Kelln is a sports medicine physician at Children's Hospital Los Angeles and is here to talk about keeping kids safe while they play. Good morning, Doc.
Thank you. It's great to be here.
Well,
I'm glad
great
to join
have
you guys this morning.
So timely because, yes, so many kids are already or will be heading back to school, back to their sports. But it's important, a sports physical check. Checking the athlete's mental and health, mental readiness and health, so important when they're in these activities. So what should parents be asking during these exams?
It's a great question. I think, oftentimes people think about the regular physical exam that they're kind of going through with their provider, but this gets to be focused on sports. So really any questions that these athletes may have or parents about the sports they're going to be participating in this is the time for it. So I think it's going to be important to kind of ask questions of, what are they getting into? If you've got a child that's playing a sport for the first time, right, what are the injuries that may come up with all of this? What are we getting into that way? Talking about nutrition, talking about sleep, some of these other components that are going to impact their child's health out there. What equipment should we be wearing, right? How do we keep our kids safe in those things? So I think coming into those visits with those questions of things they have that relate to their child and sports.
It's so comprehensive, you're right. It's not just on the field, it's the sleep, amount of sleep you get. It's what you eat. It's what goes into it, right?
Absolutely.
Yeah, Doc, great point. Yeah. In the fall, we talk about sports like football, volleyball, soccer, cross country. These are all fall sports. What are some common back-to-school sports injuries in these sports?
I think when we think about the common injuries, it's going to be kind of not necessarily the big injuries, even though those catch the attention. You're going to look at kind of sprains, kind of injuring ligaments. You're going to be injuring muscles, those strains. Another thing we look at for young athletes is overuse injuries. So when you have young athletes whose bodies are growing and developing, just repetitive kind of motions, whether it's a pitcher who continues to throw or, a soccer player doing a bunch of running, their joints are taking that stress as their body's trying to grow. So those are going to be the more common overall when we look at sports. And then each, obviously, sport itself will have their injuries that are at higher rate.
Give me an example of an overuse injury.
So an overuse, I think baseball is the one that we'll commonly think of. If somebody is regularly throwing, there's a growth plate here on the inside of the arm, and when you continue to go through that motion, the body is just wanting to grow, but we're putting this continued stress on a growing part of the body, and with time, it can create enough irritation and stress through that area that the body doesn't have time to recover from, and then result in lingering pain.
Yeah. Makes sense. So, Doc, how can young athletes help prevent these injuries? What can they do before?
Yeah, I think there's a number of things. I kind of look at it as things you can do before the season, things that you can do during the season, and then things kind of after practices or after the season to all of it. So when we're looking at kind of before the season, I think it's making sure that we're easing into their sport. I think especially this time of year, one of the things we worry about is when you have a young athlete who is kind of taking the summer off, they're resting, they want to enjoy that time, and now all of a sudden they're going out and doing that first week of high intensity sport, their body's not used to it. And so I think it's one where we want to be able to ease them into it. I usually say, can you give kind of 2 to 4 weeks kind of prior to the season start to get the body moving again, go out there, do some running, do some jogging, get the body used to it. So that will reduce a lot of injuries that way with that kind of time to warm up. I think during the season, make sure you warm up before games, right? Do some good stretching, do some good early kind of jogging before a game. One of the things that we really like to talk about is kind of a newer wave of training, or at least warming up, which is neuromuscular training programs. I think the more common one that's out there is the FIFA 11 Plus, and it's this idea of strengthening plyometrics and proprioception, or understanding where the body's at through this. And when you do these programs, it is one that's actually shown that it could increase injury risk by 50% to all of it, which is obviously very significant.
Absolutely. Well, Dr. Kelln, thank you so much for the great advice and important reminders for parents and the athletes out there.
Absolutely.
Thank you.
Thanks for having me. Absolutely.